Hello, I just wanted to do a little video to just talk you through the changes that we've had to implement during this time that we've been closed due to COVID-19 and what the clinic and the process and the patient journey is going to look like when we do reopen, hopefully in July. So there's going to be quite a few changes and all these changes have been implemented for you, for your safety, so that we offer you a safe environment to come and have treatments. And so I just wanted to kind of talk you through the processes and the new processes that will be in place so that it won't be so kind of unsettling when you first come to clinic and it's not what you're used to when you come and visit us before. So let's talk you through the process and of each stage, and hopefully you'll find this helpful and informative. So the first thing that will be different is that we are going to ask for a lot of our documentation and medical history forms, consent forms, that type of thing. We're actually going to ask for that to be signed in advance electronically. So Hannah's going to be very much involved in emailing across digital forms that will need signing and returning to us before your appointment. That just saves kind of cross-contamination of using devices to make to sign forms, etc. It just makes it all a little bit smoother, so when you arrive those types of admin details have been kind of addressed, and we will give you lots more information on that closer to the time. The other thing that we are going to ask as well is to ask for payment in advance. Now the reason that we're doing this is again to just cut down that possible transmission through using card machines, etc. So that's another new thing that we will be implementing. The next stage will be when you arrive for your appointments. We used to love welcoming you in, offering you a hot drink, a sit down, a read through magazines, and unfortunately just for this time we're not going to be able to do that. So what we are going to ask is if you come alone on your appointment, if at all possible. Obviously there's some people that's impossible, and obviously talk to us and we will work through that. But for those of people that can come to their appointments on their own, we're asking you to do that. And we're also going to ask if you would mind waiting in your car until you're called for your appointment. Again, it's all these things to try and stop any infections being spread throughout the clinic. When you get called in for your appointment, we're going to also try and limit the amount of time that patients are with us. So in the hope that we've proceeded with treatment in a timely manner. Again, that's for you and myself during that treatment to keep that treatment time down. You'll also be offered PPE that we're asking all our patients to actually put on. So we're going to be giving you a mask, and we're going to have hand sanitizer stations for when you arrive, and we will be encouraging you to use that. And you'll see me looking a lot different as well. I will be in full PPE, so I will have surgical scrubs on, disposable aprons, I will have masks and possibly a visor as well. So I'm going to look very different when you first arrive. I hope this isn't forever, but in the short term it's there for you and me, and just trying to encourage all safety measures at every point. After your appointment, you'll be leaving the clinic. If you're wanting any products, skincare, etc., don't worry, just let us know in advance. We'll still be continuing to support you with your skincare. We'll have all that ready for you on your departure. So it all sounds a bit strange. It all sounds a little bit kind of cold, clinical, and I guess it is. And it kind of goes against everything that my instincts draw me to. But do you know what? This is kind of the new patient journey for the time being. And it's more important to look at the clinical safety side of your journey at this time. And that's what we're doing. So I hope that it sends a positive message to you. We're going to be putting this all into emails as well, and we'll have all our policies and procedures, so we'll be able to communicate this to you in a written way as well. But I just thought I'd kind of touch base with you over a video. I hope that helps. If you have any questions about any of this, or you just want to discuss it with us before your next appointment, then please don't hesitate to contact the clinic, and Hannah or myself will happily help you. But please know this is coming from a good place, it's essential, and let's hope it's not like this forever. Thank you.